It is 3 minutes past the hour here, so I think let's go ahead and get started. Grateful for all of you taking the time to be here with us today. We're excited to get to know you if we don't know you. I see some familiar faces though, which is great. This workshop, just to make sure that you're in the right place. If you're not, you are in the right place. Don't leave. If you intended to be in another workshop, don't go. Stay with us. But this workshop is titled Patients Over Profits, Take the Corporate Healthcare Industry Head On. My name is Max. I am an organizer with National Nurses United. My pronouns are he, him. I am calling in from Kumeyaay Island, also known as San Diego, California. And co-hosting this workshop with me today is Alex.
Hey everybody, my name is Alex Newell Taylor. My pronouns are she, her. I'm also an organizer with National Nurses United, and I am calling in today from Wabanaki Land, which is also known as Bar Harbor, Maine. And I'm really excited to do this with you, everybody, today.
All right, thank you, Alex. So I think just to start here, I'm going to go out on a limb. I'm going to take a wild guess and say that we are all here at this conference because we believe that people are more important than profits, that patients are more important than profits, and ultimately that we need a healthcare system that reflects that belief and that what should be a reality. And if you don't agree with that, you really might be in the wrong place. You're still welcome to stay, but I'm curious how you ended up here. And I think in this fight that we're in to reform our broken healthcare system, it can often be intimidating to take action. The scale of the problem that we're facing down is so immense, and the interests that stand in the way of changing that system are very powerful, and they have an extraordinary amount of money. So today's workshop is we're going to talk about one tactic that we've been taking to take some concrete action to toxify the influence of the corporate healthcare industry in our democracy. So we're going to take a few minutes to analyze one of the barriers to reform in our healthcare system. We're going to talk about how we came to the idea of starting the Patients Over Profits Pledge. We're going to explain what that is. And then towards the end of the workshop, we're all actually going to take a few minutes to take action together on the pledge. And we're doing that just to show you how easy it is. And before we get into all of that, we'd love to go into a breakout just for a few minutes here so that folks have a chance to introduce themselves to one another and hear from others in the workshop, because that's always, I think, one of the most important things that we can be doing in these kinds of conferences. So I think, let me go ahead to the breakouts instructions here. So we're gonna again, take the time to do some introductions here. We're gonna go into breakouts. We will be in the breakouts for just a few minutes, and these are going to be just a group of about 4 to 5 people, so that everyone has the chance to introduce themselves. And so in just a moment, you'll be able to join a breakout. In fact, I think you're automatically assigned to a breakout room. And when you are in the breakout room, your instructions are to go over your name and pronouns, where you are located geographically, and then I want to emphasize it, to be brief, why you are a part of this movement for healthcare justice. Just a reminder, we only have 8 minutes, so really try to keep that answer as brief as you can. So I'll go ahead and drop that list in the chat so that you all have access to it in the breakout rooms. So go ahead and do that. All right. And actually, instead of going into a breakout, maybe we can just, since we have a kind of a small group here, why don't we do we want to just do this in the main space? Does that sound good? Okay, Alex is nodding, so we're gonna do it. So yeah, I guess the way that we could do this is, how about this? If you'd like to kick us off, maybe raise your hand on Zoom, and we'll go ahead and unmute you, and then we can just kind of go around one by one and do a quick round of intros. All right, so I see someone has their hand up. All right, Leah, awesome. So you should be able to unmute. Go ahead.
Yep, I did. Okay, so my name is Leah Schwinn. My pronouns are she, her. I'm located in Grass Valley, which is in Northern California and on Nisenan land. And I'm part of the movement for healthcare justice because I believe that healthcare is a human right, but I also believe that everyone in our community will be healthier when everyone can go to the doctor whenever they need to without worrying about money. Is that good?
Well said. Yes, that is perfect. Thank you so much, Leah. And great job also talking about Medicare privatization. I saw that message in the chat earlier that you got to split in a little bit. That's a great reason to split. All right, so I'm going to just call on folks and we can go through. So Consuelo, would you like to go next? I'll go ahead and see if you can unmute. And we're just doing, there you go.
Okay, hi, my name is Consuelo Echeria. I'm from Seattle, Washington, Healthcare for All Washington, working on policy to push universal healthcare on a state-based level.
Awesome. Thank you so much for being here. Next, we will go to, let's see, someone has their hand up. I can't see your name, but I'm going to unmute you, iPad 3. So maybe you can introduce yourself and we will know who you are, but you should be able to unmute on your end. Just give it a second. All right, we'll come back to you, iPad 3, mysterious caller. We will go next to, let's go to Norman. Norman, you should be able to unmute. There you go.
I am unmuted. My name is Norman Dowse, he and him. I'm in Cambridge, Massachusetts, part of MassCare, the state coalition for single payer. And I've spent more than 20 years working in the healthcare field and kind of all aspects of it. And I've seen all the waste. And I think that single payer healthcare is basically the only way to move forward.
All right, welcome Norman. We love MassCare. And yes, couldn't agree more with you. Let's do Kelly. Kelly next. Kelly, you should be able to unmute on your end.
Hello, everybody. My name is Kelly Coogan-Gare. I am located in Walnut Creek, California. I actually have the great privilege of working every day with Max and Alex. I am the supervisor of the folks that do the Medicare for All and CalCare campaigns at National Nurses United and California Nurses Association. Part of the healthcare justice movement. I've been involved in social justice. I've had the grace of being involved in social justice professionally my entire adult life, and really see that if you don't have health, pretty much all other indicators of social justice cannot be achieved, and you cannot be struggling for them. So health seems to be, especially the older I get, the most basic indicator of healthcare justice. So, but many reasons, we have the privilege of working with people like you every single day. And so we hear so many stories about why the struggle for healthcare justice is at the core. Thanks everyone for being here.
Beautiful. Thank you so much, Kelly. And then we'll try iPad number 3 one last time. So let me see. You should be able to unmute on your end. If not, if you're not able to unmute, you can also introduce yourself in the chat and we will stop and read that out loud. Okay, doesn't look like coming off mute, so that's okay. All right. Oh, I see you're off mute now. You want to go for it?
Am I on? I'm Charles Stander. I'm from St. Paul, Minnesota. I'm a member of Health Policy Advocates, strictly a volunteer group. But what we're trying to do is to give people on these corporate Medicaid program to have them cross over and head into a state-run fee for service program. We finally got the legislation on the books, and most likely it's going to pass this session. Thank you.
Awesome. Thank you so much. And thanks for representing Minnesota in the House. And yeah, you touched on another important, I think, priority for our movement, which is, well, we move to kind of expand the public insurance model. We also need to make sure that we're fighting attempts to privatize it, which are constant. So yes, thank you for your work, and thanks for being here. All right, so thank you everybody for going over those introductions. It's always a good start to the call to kind of get a sense of where everybody's coming from. So I will pause it there. I'm going to pass it back over to Alex, and Alex is going to kick us off here.
All right, thank you, Max, and thanks everyone for your intros. Bob, I see that you just joined us. If you would like to introduce yourself in the chat, please do so. We just shared our names and pronouns and where we're located and why we are part of the movement for healthcare justice. But let's keep going. Lots to get through today. So again, like we mentioned at the top of the workshop, the Patients Over Profits campaign is led by National Nurses United, which is the largest union and professional association of direct care registered nurses in U.S. history. It's helpful for you to know that in the founding of our union, nurses came together to call for action to counter the national assault by the healthcare industry on patient care conditions and standards for nurses, and to provide a unified vision of collective action for nurses. And NNU is deeply invested in fighting against the ever-present threat of corporate takeover of our healthcare system. Nurses are on the front lines of our healthcare system every day and can see the many problems caused by our largely employment-based, money-driven healthcare system. And we regularly go toe-to-toe with the largest hospital, pharmaceutical, and insurance corporations in the country. Nurses see every day the impossible decisions that patients are forced to make regarding their health, like choosing between a medication that they need and their groceries or their rent. And we see clearly that patients are forced to make these decisions because of the constant and insatiable need of the corporate healthcare industry to make bigger and bigger profits. So we also see the immense influence that the healthcare industry has on our government. The industry that spends more money on lobbying than any other in this country is the pharmaceutical industry. And the second highest spender is the insurance industry. And just a few places behind that is the hospital industry. You can see here on the slide how NNU nurses have stood up against this type of influence on our democracy over the last few years. These photos are from before the pandemic, but you can see here on the slide some pictures of actions that we did. One where our nurses delivered a fake pill prop full of monopoly money to Speaker Nancy Pelosi, of course, to symbolize the money that pharma was spending on lobbying Congress. And you can also see some photos of an action that we did outside of the pharma headquarters, where we taped printed images of patients using GoFundMe to raise money for their healthcare costs. And you can see that we taped those pictures to the front door using Band-Aids to symbolize the Band-Aid solutions that they try to propose instead of the actual healthcare reform that we need. And it's not just through lobbying that healthcare corporations are able to get what they want. They also spend an incredible amount of money on political campaigns, in donations directly to the campaigns of elected officials and through independent expenditures to influence elections. Now, simply put, we believe that this is wrong and detrimental to the quality of our healthcare system. At our core, we believe that healthcare should be a human right, and that if you need care, you should be able to get it. We also believe that to stand up to corporate power to create a healthcare system that truly works for all people, that will take a unified effort of caregivers like nurses, and patients working together. More specifically, we believe, as I know all of you here do too, that the best way to achieve a system that is universal, which allows people to get comprehensive, high quality care, is Medicare for all. And we know that this type of system would allow us to vastly improve the delivery of healthcare in this country and at a lower cost. So now that we have that background, I'm going to pass it back to Max to talk about why we started the Patients Over Profits Pledge and what it aims to accomplish.
All right, thank you, Alex. So I want to just kind of zoom out for a moment and define what I think is the core problem in the American healthcare system, which I think that we all agree on, which is that our system is fundamentally broken. It does not work for the vast majority of people. One kind of sub problem is that it is expensive, and it is more expensive than any other system in the world. Another kind of facet of this is that it is inaccessible. So there's an estimated 26 million people in the U.S. who have no form of health insurance, and that number is likely vastly increasing right now, with about 15 million people potentially about to be kicked off of Medicaid. Not to mention that there are at least an additional 40 million people who have health insurance technically, but they don't use it because they can't afford to use it, right? Because of cost sharing barriers to care, such as deductibles and copays. And I think there are a lot of problems that go into it, but one of the core issues is that our healthcare system is by and large run by gigantic healthcare corporations who make tens of billions of dollars in profit every single year, and then use huge sums of money as a part of those profits to buy political influence. And they do that through lobbying to craft legislation and regulation, and also by campaign donations to help kind of pick who is elected to office. And they use this influence to get government subsidies. They make sure that regulation is favorable to them or non-existent. And I think, to summarize it, they use political influence as a strategy to help maintain their bottom line. And so we really believe that that is one of the major barriers to reforming the healthcare system, is the fact that there are these giant for-profit corporations and they have a very expansive political strategy. And so, kind of building on that premise, we believe that it is necessary to reduce the amount of power that these huge healthcare corporations have on our government. And so that is precisely why we created the Patients Over Profits Pledge campaign. And we did this alongside a large coalition of other groups fighting for healthcare justice, just a portion of which you can see here on this slide. Thankfully, there are too many organizations who have endorsed it now to fit them all on one slide. And so I think, hopefully I've identified a specific problem, a specific barrier to reform for everybody. And so I'm going to ask, what's the solution, right? How does the Patients Over Profits campaign seek to address this problem? So to kind of go into the basics and hopefully answer that question, the Patients Over Profits campaign and specifically the Patients Over Profits Pledge is a pledge that calls on politicians to reject campaign contributions from the executives, lobbyists, and PACs affiliated with the corporate healthcare industry who are scheming to further take over our healthcare system. And this pledge really takes this fight directly to the for-profit healthcare industry and goes after very specifically their direct financial ties to our elected officials in the form of campaign contributions. And so, as you can see on this slide, it reads, quote, "I pledge to put patients over profits and not take contributions over $200 from the executives, lobbyists, and PACs affiliated with the corporate healthcare industry, including private insurers, pharma corporations, and private hospitals who are organizing to take over our healthcare system." End quote. And we know that this kind of tactic can work. We actually drew inspiration for this from something called the No Fossil Fuel Money Pledge, which has really been successful in the last few years in turning campaign donations from the fossil fuel industry into more of a liability for elected officials. And the organizers behind that pledge gave us a lot of really helpful advice as we were in the early stages of starting the Patients Over Profits Pledge. So that's the basics of it. So I'm gonna talk about now how it works. So in practice, what it looks like is it usually means that someone, like a supporter of the pledge, volunteer, someone approaching a candidate or elected official and asking them to take the pledge. If they say yes, then there is a very brief process that we have to verify that they took the pledge. And then that is pretty much it. So this process of asking them to take the pledge happens in two different ways, broadly speaking. And so one typical way is that you identify someone who you'd like to ask to take the pledge. You then find their email or their phone number, and then you reach out to them, directly to ask them to take the pledge. The second way is that you have a blank pledge form printed out. You can see some filled out pledge forms here on this slide, but you have a blank pledge form or blank pledge forms, plural, printed out, and you go to an event that you know there's going to be a candidate or elected official in person at, and then you ask them in person to sign the pledge. Just to kind of give you a sense of how it's kind of broken down so far, a majority of the current pledge signers were asked to sign digitally, so via email. But we've also had some volunteers who have gone to events in person and were able to get multiple pledge signers at a time. Actually, I think I think all of the pictures you see on your screen here were from one person. Shout out Ken from Arizona, who went to an event and in one fell swoop got like 6 or 7 candidates and elected officials to take the pledge, which is very helpful. And so the pledge has thankfully started to gain some momentum. We actually just passed a huge milestone just last week with now 100 elected officials and candidates across the country taking the pledge, which is really, really exciting. But we also know we're just getting started, right? That's ultimately a drop in the bucket compared to the overall amount of elected officials and candidates. So it's a good start, but we have a lot of work to do ahead of us. So where do Medicare for All supporters fit into this? So one of the really great things about this campaign is that it can be worked on by anyone, anywhere in the country. You don't have to be in a specific place. You don't have to have any specific background. You don't have to have connections to campaigns or elected officials or candidates. We have people in dozens of states who have been working to get new signers on the pledge. And it's very easy to do so. And we're actually going to do this later on this call. We're actually going to all together collectively reach out to some folks and ask them to take the pledge. And we'll break that down just so that you can really easily see how it works. So how generally speaking, how do you get to work? How do you know where to start? So we have a ton of great resources to make it really easy for you to take action. So what you're seeing on this slide is a screenshot of a guide that we have that explains the process. It goes over all of the relevant links to different documents and resources, and is a straightforward tutorial on how to ask someone to take the pledge. And right now, what I'm going over is just really an overview. Like I said, in just a few minutes, we're going to actually dig into the details, step by step in this process, and go through it together. So you'll really get to see how it works. But that is not all. We also work together to share trainings and resources and spaces for community building. So in the past, this has taken place largely on Zoom, but that is what allows us to kind of coordinate this across the country, as well as to easily share updates on our progress, as well in addition to sharing tips on how to make the work more effective and how to do it more effectively. So I want to actually reiterate that this is a core part of our organizing philosophy, that we have a role for everyone everywhere to play. And so what I mean by that is that, again, you don't have to live in a specific area in order to join this campaign and to take action. Having said that, though, I will add that this year we are making extra effort to build the popularity of the Patients Over Profits pledge in the South. We've been talking today about how the US spends more on healthcare than any other country in the world, yet at the same time has much worse health outcomes across a variety of measures. And I think if you look at the US, there's actually some pretty great disparities within the country, depending on what region you're looking at. And nowhere, I think, is the dysfunction of our system more apparent than it is in the south of this country. That is a region where health outcomes are among the worst, where communities are being, particularly ravaged by hospital closures, although that's obviously a phenomenon that's happening elsewhere in the country as well. The South is also a region, though, where, I think just suffering is greatest at the hands of the corporate healthcare industry. And so for those reasons, and for more reasons, we believe that this region has to be a priority for building momentum against corporate power. So that's just to say that if you live in the South, we especially can't wait to work with you. But again, just to reiterate, no matter where you live, there's a role for you to play in this campaign. In just a moment, we'll pause to see if anyone has any questions before we continue. But I'll just make one last note about our strategy. Right now, I think we are still kind of in the early phases of this campaign. And in this phase, we know that it's really important to get as many signers as possible to help build up the credibility of the pledge. And so to that end, we've kind of strategically been focusing on trying to get signatures of what we generally call low-hanging fruit candidates and elected officials. And so that means that we've started by asking the most progressive candidates and elected officials. And these are often people who, so some of them already project contributions from, corporations in general or the corporate healthcare industry. But the reason that we're doing that is because we want to build up, a respectable number of signers. And then once we are able to do that, then we can kind of transition the campaign to focusing on higher profile candidates and elected officials, many of whom do currently take money from the corporate healthcare industry. But, as you can imagine, if we were to go to some of the biggest, the candidates and elected officials who take the most money from the fossil fuel industry, before we had anybody sign, their first question to us would be, well, okay, well, who else has signed? And then we would have said, well, you'll be the first one. And that would not have gone well. So again, it's kind of necessary that we're in this phase of building up signers. Like I said, we've hit 100, which is a great start. And then we'll kind of move from there on to, creating a little bit more friction with the people who take a lot of money. So that was a lot, hopefully not overwhelming. I will pass it over to Alex now to just pause and see if we have any questions at this stage.
All right, thanks, Max. So yeah, good point for us to stop the presentation for a moment, answer any questions that you might have at this point. So if you do have a question, please go ahead and use that hand raise button. Again, this is under reactions at the bottom of your Zoom screen. You can also ask a question in the chat if you would prefer. So I'll just pause for a minute and see if anyone has any questions. All right, I'm not seeing any hands raised. Possible somebody's typing in the chat, so I'll give it just a few more seconds. All right, well, it doesn't look like we have any questions. Good, that means we're doing our job well, Max. But if you have any questions that do pop up, feel free to use the chat at any time. Okay, so let's keep going then. So what we're going to do now is we're going to show you exactly how a lot of the work on the Patients Over Profits campaign gets done. So I'm going to take you very quickly through a brief training on how to get started. Now, this training should take no longer than 10 minutes. And then we're actually going to spend a few minutes of our time together working on outreach. This is going to be a working workshop. And while we do that, of course, I'll be able to answer your questions in the chat if you have any. Okay, so here we go. I'm going to share my screen so that you can see what I'm talking about here. This is our Patients Over Profits National Pledge Tracker. So the first thing that you will need to do to get started is to go into this tracker. This is where we store all of our information about which politicians we want to contact and which we have contacted so far. So we have a few different tabs here on this tracker. You can see the tabs at the bottom of the screen, but also they're linked here in the directory on the first tab. Now for today, we're going to focus on a couple of these tabs. Some of the newer tabs titled DSA Electeds and Clean Money Candidates. So again, those tabs are at the bottom of the screen, and we want to give a shout out to our stellar research team that's been working really hard over the last few weeks to help prep these lists. So I'm going to talk about this DSA Electeds tab first. So let me go to that one. So what this is a list of all of the elected officials who are members of DSA, the Democratic Socialists of America. And we believe that this group will be highly amenable to taking the Patients Over Profits pledge. And already quite a few of them have taken the pledge, such as California Assemblyman Alex Lee, Massachusetts State Representative Erica, I'm not going to know how to say this last name, Uterhoven, and Allegheny County Council member Anita Prizio. Wait, somebody telling me, oh, nailed it. Thank you, Max. All right, so there's a lot of information in this spreadsheet, but right now I want you to concentrate on columns L and N. So I'm just going to scroll over. This is a large spreadsheet. I'm going to scroll over until you see columns L and N. So this is where you can claim an elected official to reach out to. So that means that you will be responsible for emailing that elected and asking them to take the pledge. Now, most of these electeds have already gotten a first touch. So you can see that in column L, that a lot of these people have already been reached out to once, but we want each of these people to be reached out to twice. And that's why you see in column N, you can do a second attempt. And it means that this person, if it's highlighted in yellow, still needs to be reached out to either for the first or the second time. So just for example, line 14 here, Lizette. Lizette has not been reached out to at all. So she needs a first touch and a second touch. But everyone else up above Lizette, they just need a second touch. Now, in just a moment, I'm going to share the link to this document, and I want you all to come into this spreadsheet and claim just 5 people by writing your name in column L and or N alongside those 5 people that you are going to contact. Now, if there are candidates or elected officials from your state, or better still from your district, I encourage you to look and see. It's organized, I believe, by state. Yep, it's alphabetical by state. So look first and see if there's anyone in your area, and definitely claim those people. But if there aren't any near you, do not worry. We believe that all of these candidates will be receptive to our campaign. So please go ahead and claim people from any state that you want to, where you see that yellow. All right, once you have claimed your 5 electeds, we're going to start contacting them. Now in column G right here, you will see their email address. So all you need to do is, in just a moment, I'm going to share another link, and that is to an email template. So all you're going to have to do is copy and paste from that email template, use the email address listed here, and send an email to this elected official. Make sure that you read the email first before sending it, in case you want to make some small edits. But one note here, at this point, we are aiming to reach out to as many people as possible. So we highly recommend starting your outreach on the rows that already have an email address listed, which should be most of these. And we highly recommend simply copy and pasting the email template. So you'll find that email template specifically for reaching out to DSA electeds here at the top left of the screen, highlighted in yellow. It says sample email here. You just click to open it. We'll also put that link in the chat in a moment. Now, ideally, it shouldn't take you more than a minute or two to send each email. Now, after you've emailed your candidate or your elected official, we want you to do one more thing, and that is scroll over to column P right here, or Q. And you can put the date, today's date, so the 23rd of April, into this column. So if you were reaching out to Youssef here, oh, he's no longer serving. Kristen here, it's the first touch, you would put in column P, you'd put the date right there. If you're doing the second touch, you can put it here in column Q as the latest contact. So that, oh, and then one last thing, you're also going to go over here to column R and type in that you emailed this person. All right. So that is it. It's that simple. Let me just review those steps just to kind of recap. So step one, you're going to claim your 5 elected officials by putting your name in column L or column N, anywhere that you see yellow. Step 2, contact the candidates using their email address in column G right here. And then use our email template so that you can send as many as possible during our time together today. Step 3, go over to column P and Q to let us know the date, then so we know that you did it. And then in column R, put email. And then that is it. You're in step 5 is you're going to claim another 5 candidates or elected officials to reach out to. Now, one word of caution is that this is a Google sheet, which means it's collaborative. And it means that when you edit the spreadsheet on your computer, it will update in real time for everyone else. So that means that in just a moment, when you claim your 5 people to reach out to, you just want to be careful to make sure you're not overwriting someone else's name. So just be on the lookout for other people's. You can see here how I have a blue square. That means that that's showing that that's where my cursor is. And just be on the lookout for other people's little colored square that you're not going to write on top of them. All right, now we have one other project that we could work on today. If reaching out to the DSA electeds is not getting you super excited, we have another project, and that is reaching out to elected officials in Maine, my state, who have participated in our Clean Elections program. Maine has a really robust Clean Elections program, and this program allows candidates to receive public campaign funding if they pledge not to receive campaign donations over $5. So let me switch over to that tab here. So there's a small list here, small-ish list of people, about 60 people in Maine who have participated in the Clean Elections program. And we'd like to reach out to them to ask them to sign the pledge because they're already in compliance with it. So in theory, it should be very easy to get them to sign. So we've already had a few people from Maine sign, and with your help, we can get even more. So to help on this project, you're just going to go to this tab. Again, it's titled Clean Elections Candidates. And just like we've already talked about, you're going to enter your name anywhere that you see here in yellow, where the person has not been reached out to yet. And then just like we talked about, you're going to then go over to the next column and let us know the date, today's date, and then to the contact method and choose email. Now, one thing I do want to point out here is that there's a different sample email here because our messaging is a little bit different. So whichever tab you're on, just make sure that you're using that specific sample email that is linked at the top left-hand corner of that tab. Okay, so I think that's it for the screen share. So I'm going to go ahead and end my screen share. But we're going to go ahead and put the link to that tracker in the chat now. This is the Patients Over Profits National Pledge Tracker. Putting it in. There we go. And all you need to do is click on that link that I just put in the chat. And once you open the tracker, we're going to encourage you to click on either one of those tabs that we just showed you at the bottom, the DSA electeds or the main clean money candidates, where there are lots of people to claim and reach out to. Again, you're going to navigate to column L and claim the 5 candidates that you will contact by adding your name next to the candidates or people that you will contact. And so go ahead and do that right now. And then let us know in the chat when you have chosen your 5 people by typing POP in the chat. So I see some people entering the spreadsheet here. This is good. All right, so you're in, just go on over to those columns, enter your name, and then let me know in the chat by writing POP when you are ready for the next steps. Now, in the meantime, I'm going to go ahead and drop some more links in the chat. This is the sample emails. Again, these are linked in the spreadsheet, but we'll put them in the chat as well in case that's easier. So this is the sample email to DSA electeds, and then the sample email to the main clean elections candidates. Thank you. All right, so again, when you have claimed your 5 elected officials to reach out to, you're going to just type POP in the chat so we know that everyone is staying together and staying, no one's falling behind. Give it just a few minutes more. And if you're having any problems using the spreadsheet, you can type questions in the chat or raise your hand. Okay, I see a question from Consuelo. I'm going to unmute you or ask you to unmute.
Yeah, because there's so few of us, it doesn't feel very conducive to having conversations to have us all unmuted. That's my first comment. My second comment is in terms of your tracker, congratulations, by the way, this looks great. It's not relevant to what we do, but it's a really interesting thing to see. So I'm just curious, are you having your constituents or your activists in all of the different states enter this data, or who is entering this data, and how, and who is in charge of the tracking of this data? And how many hours a week is this taking from your activists' time to do this?
Yeah, great questions. To your first point, you're right. And now that we're done with the with kind of the lecture portion of this workshop, maybe we can go ahead and make it so so folks can unmute themselves if they'd like to. So I'm going to change that. But to your second question, we have actually an entire volunteer research team that we've put together that really helped us enter most of the information into these spreadsheets. As far as the amount of time that's taking, gosh, it's hard to say exactly. We do weekly action calls every Wednesday night, which are about an hour and 15 minutes long. And a lot of the work's been being done on those calls. I know that some work has been happening outside of those calls. Do you have a good estimate, Max, of how much time that's been taking?
I mean, it's kind of very variable because you know, some people really get into this, and I get the sense they spend a lot of time doing it because it's just, you know, fun, and you can do as little or as much as you'd like. That's the nice thing. Like, you can reach out to 2 candidates, you can reach out to, you know, 50. So it's really kind of a little bit of a choose your own adventure. But yeah, I mean, reaching out to 5, just to give an example, if their contact information is already in the sheet, which it is for most of these folks, reaching out to 5 candidates will, like, me personally, takes like 10 minutes. Like, it's very quick. Some of, you know, the time, it's not the same for everyone, right? It's a little bit slower for some people to, you know, kind of navigate between a bunch of tabs and copy paste emails and stuff like that. And then of course it varies if you're calling them versus emailing them. But it really depends. Like I said, I think some people just join the calls and they spend, you know, an hour a week doing it. And then other people, like especially people on the research team, I think they just do tons of it because they love it.
You know, it's a really good sheet. This is a lot of work.
Yeah, it's
Having,
definitely a lot
having
of work.
worked with data for, yeah, this is a lot of work. And it's really nicely laid out. It's really easy. It's really good. Congratulations. I love that you have a clean money candidate sheet that you're tracking. It's excellent.
Thank you. Thank you so much. All right. So hopefully everyone is pumped to spend a few minutes like actually sending some emails here. I think it's good to just kind of just get to it and do it. And like once you send those first few, you'll find I think that it's addictive. You just want to send a bunch more. You see how easy it is. And you just maybe might want to spend like 30 minutes even after this workshop ends, just sending some emails. So we're going to spend the next like 5 to 10 minutes, I'd say, together doing this. So Max, you ready to play some music and we'll give people some time to do this, or?
I am ready. I just want to also say, I'm an organizer. I'm not a DJ. I will take requests, so I won't promise that what I put on is what you want to hear. So I'm just letting you know. If you want to hear something, let me know in the chat, and I will put it on the queue.
All right. And the steps are here on the slide. If you forget the steps or forget which columns we're working in, so we'll leave that up on the slide and we'll just play some music and hang out for the next few minutes.
Whoops, I probably should unmute myself here. Yeah, we'll be doing this for about 5 more minutes. At about 30 minutes past the hour, we will move into some next steps before we end the workshop. But feel free to unmute and ask your questions, ask them in the chat. And okay, I see one question in the chat from Deborah. So Deborah's asking, can't unmute. Okay, let me see if I can change that. Let me double check this
Sorry,
setting
I
real
thought I
quick.
already did.
It looks like folks could unmute from my end now. Does that look right to you, Alex? But yeah, to answer your question, Deborah, so the easiest way to use the letter is to copy paste it. So to like highlight all the text, and then if you're on a Windows, right click.
Okay.
Yeah. Yeah.
All right. I'll try that.
Okay, perfect. Yeah, I wonder if there's,
I think
that
it's
would
changed.
be, if we could figure out a way to do like one of those links where it kind of preloads in your email, that would cut out some steps here. But I'm not sure how we do it from Google Docs.
Hi, Greg. Thanks for joining us. Just to kind of tell you what we're doing right now, we're in a little bit of like a work session where we're having folks in the workshop reach out to elected officials and ask them to take our Patients Over Profits pledge. So I'm going to drop a link in the chat for you, Greg, in case you want to just jump in. This is our Patients Over Profits National Pledge Tracker. We're working on two tabs here, the DSA Electeds tab and the Clean Elections Candidates tab. And all you need to do is go to one of those tabs and then follow these action steps that are on the screen. And we're basically just reaching out to elected officials and asking them to take our Patients Over Profits pledge. I'm going to re-up 2 more chat links in the chat here. This is the email template that you'd want to use for DSA electeds and the email template to the Clean Elections candidates. They're a little bit different from each other. And again, all you need to do is open those links, copy, paste, and copy the email that's there in that document and then paste it into your email program. And then use the email address listed to send an email to that elected official.
All right, thank you.
Yeah.
All right, I'm going to throw the music back on. We got 3 minutes left, and then we'll kind of go over some final steps here before we wrap it up. music down. Okay. All right. Well, good job, everybody. Great work. We are almost here at the end of the workshop. So thank you for your attendance today and your attention, your help, and your questions. But as I said, I have some important kind of next steps to share with everybody before we part for the day. Go to the next slide. I think first things first, if you enjoyed this exercise, or if you didn't enjoy this exercise, I scratch that out. Even if you didn't enjoy this exercise, I want to challenge everybody here to go into the spreadsheet right now and claim another batch of 5 candidates to do some outreach to during the next week. The cool thing about this, this kind of the way that this has been set up is that once you have the links, once you kind of know how it works, you can just kind of plug away at it on your own time, whenever you'd like. So I'd like to challenge everybody to claim 5 candidates who you will reach out to maybe later today, maybe in the next few days, in the next week. If everybody did that, that would be another like 45, 50 candidates and elected officials that we are reaching out to over the coming days just from this workshop, which would definitely net us a couple more signers, which would be great. So again, I want to challenge everybody to go into the spreadsheet, find 5 candidates who need to be claimed, add your name to reach out to, and if you're able to do that, why don't you just put pop in the chat so we can see and celebrate you. So the next thing I'd like to do here is to share a link to the Patients Over Profits campaign guide. Now we share a lot of links. It's maybe will be our downfall. We share a lot of links on these calls. Sometimes it could be a little bit much to kind of keep track of. The good thing is this link in particular, the Patients Over Profits campaign guide, has all of the other links in it. So if you keep one link going out of this call, if you bookmark one link, make sure that it's the Patients Over Profits campaign guide, because that is kind of the hub for the Patients Over Profits campaign work. So I encourage you to bookmark it so that you can find everything when you reach out to those 5 additional people later today or in the next few days. In addition, it has some really useful information that you can use to kind of keep building on the work that we did together today. It also tells you what to do if you, for instance, get an email back from a candidate saying, "Oh yeah, sure, I'll sign the pledge." So that important information is in the guide. So make sure to click that link, save it, bookmark it, write it down, whatever you need to do to save that. You will also see in the guide that there is another way that you can get candidates on the pledge, and that's that you can identify and reach out to candidates who are local to you but are not yet on our list. So as you can kind of tell from the tabs, there's a few different types of candidates that we have researched and compiled the information for to reach out to. But as I said at the beginning of the call, this is really just kind of a drop in the bucket of the overall amount of candidates and elected officials in this country. So that's to say that there are a ton that are not in this spreadsheet. And so if you have some that you'd like to reach out to and they're not on this spreadsheet, there is a process for you to essentially submit their information to us to let us know that you are going to ask them to take the pledge, which is really important for us to track. So I think I want to definitely encourage you, if you're doing this in person, if you're going to an in-person event, to ask folks to take the pledge. We definitely want to track that. So all of this again is in the guide. So that is I want to just refer you back there for additional information on this. And then finally, we have one more link for all of you, and I'll put this in the chat right now. And this is important for you to open up before we wrap up this workshop. I think Alex is going to put this link in the chat. And it is a link to our campaign sign up. And so that link is going to be in the chat in just a second. If you click on it, you'll see a form with just some basic contact information fields. If you are interested in being a part of this work in the future, and you want to get updates related to patient social profits, I'd encourage you to fill out that form, and we will keep you in the loop as to future calls to action and future ways to participate. So if you want to stay in touch with us around this specific tactic, please let us know. Yeah, we'll take it from there. So let's see. I think that brings us to the end of the workshop. So thank you so much for sticking with us. Thank you so much for all of your amazing work. We are truly grateful to be in this movement with all of you. All right, I see some pops in the chat. Thank you, Deborah. So again, everybody, make sure you claim your 5 people in the spreadsheet. We will be checking, and we will make mental notes of who did it and who did not. So yeah, if you have any questions, if someone responds to you and you don't know what to say, you can always reach out to us. info@medicareforall.org is the email address for us. So that's the best way to reach out to us. You can also keep notes in the tracker. We didn't go over all of the columns. There's way too many. We didn't want to try to overload you more than was necessary. But there are there are some places in the tracker where you can keep notes. If you kind of scroll to the right on any given row, there should be a notes column. So you can always write notes in there for us to see. But yeah, I think that's it. Thank you so much, everybody. We hope that you enjoy the rest of the conference. And we hope that we run into you again out there in the healthcare justice movement. Yeah, thank you so much for being here. And we're a few minutes early, so maybe take this opportunity to use the restroom, grab a snack, stretch out, pet your cat, pet your dog, and we'll see you in the closing plenary. Thank you so much, everyone.
Thanks, everyone. Have a great rest of your day.